Atrial fibrillation, causes and triggers. Atrial fibrillation is an irregular rapid heartbeat. During an atrial fibrillation attack, the heart might not pump enough oxygen-rich blood to the rest of the body, leading to symptoms including weakness, lightheadedness, and dizziness. Atrial fibrillation, or AFib, itself is not usually life-threatening, but it can lead to serious complications such as a stroke or new or worsening heart failure. Though there are many treatments available, a person can take more control over atrial fibrillation by knowing and avoiding common atrial fibrillation triggers. Atrial fibrillation triggers. As with many medical conditions, certain situations and factors can contribute to attacks or flares. Here are some potential triggers that may cause atrial fibrillation to flare in people. Travel. Taking a trip can cause an atrial fibrillation attack due to a person becoming overtired. The stress of travel and changes in sleep patterns, all of which can trigger the fight or flight response. When traveling, people with atrial fibrillation should be sure to get enough sleep, stay hydrated, and not skip meals. Medical procedures. Heart surgery is often associated with an atrial fibrillation attack. Any surgery that causes stress in a person can also trigger an attack. A patient with atrial fibrillation should let their doctor know before undergoing any medical procedure, even a minor one. Exercise. Low or moderate intensity exercise is generally considered good for a person with atrial fibrillation. However, a sudden increase in exercise or a workout that is too intense can trigger an atrial fibrillation attack. Getting overheated or dehydrated while exercising can also trigger attacks. Holidays. Holidays offer many triggers, including stress, fatigue, and alcohol use. Any one of these alone can be a trigger, but when combined, they create a much higher risk of an atrial fibrillation attack. Alcohol. People with atrial fibrillation should significantly reduce their alcohol intake. Although there is no recommendation that works for all people, minimal to moderate consumption is usually best. Alcohol consumption has an especially irritating effect on the heart, and binge drinking is a major atrial fibrillation trigger. Stress. Stress is a very common trigger for atrial fibrillation. For this reason, people with atrial fibrillation need to be able to identify personal stressors and take steps to avoid or reduce them. If they can't rule out all causes of stress, practicing stress reduction techniques such as yoga, deep breathing, tai chi, or autogenic practices can lessen the impact. Fatigue. Extreme fatigue can trigger an atrial fibrillation attack because it puts stress on a person's body. Sleep deprivation or physical exhaustion can both play a role in triggering an atrial fibrillation attack. Air pollution. Atrial fibrillation attacks may have a link with air pollution. People living in areas with high levels of air pollution have been shown to have increased attacks of atrial fibrillation compared to others living in less polluted areas. In these cases, the problem appears to be the very fine particles of pollution released from cars and power plants. These particles move deep into the lungs and trigger attacks. Dehydration. Lack of electrolytes in the blood associated with dehydration, especially potassium, can trigger atrial fibrillation symptoms. Dehydration occurs during exercise, hot weather, and illness that causes vomiting or diarrhea. Caffeine. Traditionally, doctors have considered caffeine consumption from drinks such as coffee, tea, and soda as a trigger for atrial fibrillation. However, more recent evidence suggests that atrial fibrillation might not be triggered by caffeine intake. Doctors are likely to suggest that people with atrial fibrillation avoid caffeine or drink it in moderation until there is more proof that caffeine has no ill effects on atrial fibrillation. Over-the-counter drugs. Over-the-counter cold, flu, and cough medications can trigger atrial fibrillation attacks because these medications stimulate the heart. Recreational drugs. Marijuana can stimulate the heart through raising the heart rate by a significant percent for several hours. Other drugs such as cocaine can also trigger an abnormal heartbeat. Abusing cough or cold medication for recreational use can also trigger an atrial fibrillation attack. Causes. Atrial fibrillation is commonly caused by changes or damage to the heart's structure. A possible causes of atrial fibrillation include heart attacks, viral infections, high blood pressure, aging, lung diseases, coronary artery disease, abnormal heart valves, heart defects, overactive thyroid gland, certain medications, caffeine, tobacco, or alcohol. The heart's natural pacemaker not working properly, stress, previous heart surgery, sleep apnea. Though these are common causes of atrial fibrillation, some people have atrial fibrillation without any heart defects or damage. This condition is called lone atrial fibrillation. The cause of lone atrial fibrillation is not always clear. However, serious complications for this condition are rare. Tips for avoiding triggers. Avoiding an atrial fibrillation attack will largely depend on the individual. What works for one person with atrial fibrillation may not work for another. Equally, what might trigger atrial fibrillation attacks in one person may not have the same effect in another. In general, a person with atrial fibrillation should do the following to reduce attacks. Avoid or reduce stress. Take part in well-monitored light exercise. Get plenty of rest. Stay hydrated. Avoid things that have caused an atrial fibrillation reaction in the past. Lifestyle tips. Avoiding atrial fibrillation attacks is not always easy. Often, the best method to avoid atrial fibrillation attacks is to make some lifestyle changes. Some lifestyle changes that may help can include taking part in moderate exercise a few times a week, increasing the number of hours spent sleeping, decreasing or avoiding stressful situations, avoiding alcohol or drinking only in moderation, quitting smoking, eating heart-healthy meals and snacks, maintaining a healthy weight, following a doctor's recommendations and taking prescribed medications. In general, following a healthful lifestyle can help a person avoid an atrial fibrillation attack. Improving overall health should help most people avoid signs and symptoms of the condition.